A very busy year for members of the 117th Congress. While many bills are up for consideration, one would declare racism a public health crisis. Nohalani Graff explains what this would mean politically for our country.
A country divided. 2020 marked a year of nationwide protests, thousands taking to the streets in cities across the country, calling for an end to racial injustice and police brutality. All of that happening while in the midst of a global pandemic.
It has been wrenching. It has been, for so many generations, unprecedented upheaval, disorientation, loss, exclusion, racism. So many have suffered from pandemics, plural.
Lois Brown is the director of ASU's Center for the Study of Race and Democracy. She says what we experienced in the past year not only tested us as individuals, but collectively as Americans.
There's just been so much that has exposed, in a way, how weak our democracy actually is. And that's a really frightening place to be, because democracy is what makes us unique. It's what makes us an inspiring nation for so many.
So how do we move our country forward, heal our communities, and restore hope?
It comes down to a question of what work still needs to be done. And the answer is a tremendous amount. Are there more hands willing to do the work? Yes. Are there more hands being able to do the work? Yes. So let's get to it.
The work for some starts with legislation, implementing new policies that can help underserved communities. The Anti-Racism in Public Health Act was brought forward by Senator Elizabeth Warren and Congresswomen Ayanna Pressley and Barbara Lee. The measure would declare racism as a public health crisis on the federal level, making room for funding and research that would help break down structural racism in areas like healthcare and law enforcement. But Brown says it shouldn't stop with one agency.
Everybody's implicated now in thinking about how decisions that are informed by racism, shaped by racism, perpetuated by racism, actually undercut the health of our citizenry, of those who reside within our borders, and the health of our democracy. So that, I think, is the most significant piece that comes out of this legislation and this proposal.
And as of this morning, Congressman Raul Grijalva is the only Arizona legislator who has co-sponsored the Anti-Racism in Public Health Act. On Tuesday, we'll look at how racism is impacting communities of color and what experts say can be done to create lasting change.